See, when I was doing my post graduation in 2005 to 8, they were saying that the diabetics also only you take a diabetic history only if somebody is above 40 years. But now the situation has changed. We are seeing diabetic even at 25, 30 years also. So after my finishing my MD, I started practicing like a regular allopathic practitioners. Usually, what happens? Any diabetologist, any doctor, when the patient comes now, your sugar is high, they will give a tablet or insulin to control the sugars.
Right.
So suppose if you have a fever, you have a typhoid fever. If you take a crocin or a calpol or a dolo, what happens? Fever will come down. But it is not the treatment for a typhoid fever. The treatment for the typhoid fever is antibiotic. The paracetamol is only reduce the fever. Similarly, majority doctors are controlling only the blood sugars. And nobody is looking into the root cause, what is causing blood sugar high. So giving diabetic medications and insulin is only to control the symptoms of diabetes, that is high sugars. But doctors are not actually treating the root cause of the high sugars. So this interest to address this root cause led me to read many things, maybe some research into this, analyzing the patients, what this and all. And based on this, I started low carb diet, started myself, and I started telling my patients, and finally made it a professional thing to as a part of my practice. Low carb diet, intermittent fasting, and other lifestyle diseases, wherein at least in many patients we have brought a remission of diabetes, type 2 diabetes, and in some old age patients, those who cannot maintain the diet completely, we cover about it 50% reduction of dosages. At least we make them off insulin, or we make them reduce the doses from four tablets to two tablets or two to one.
That's amazing, doctor. So, based on your experience, like you talk about the root cause of diabetes, and what is the main driver for diabetes in India? Is it carbohydrates? Is it energy toxicity? Or is it visceral fat? Or is it genetics? There are so many reasons, but what are the top reasons in your mind as a root cause?
The top reason is 70% of the cases it is diet.
Diet.
Okay, 70% cases. In remaining 30% cases, it could be your lack of activity, it could be a stress, it could be some strong family association, and sometimes even the pollution and other things. But 70% what is causing the type 2 diabetes epidemic is the high carb diet people are eating across India, especially more so with the vegetarians, because hardly 25% vegetarians are eating proper proteins.
Right.
Otherwise, vegetarians are more protein deficient, having a protein deficient diet than non-vegetarians. Even non-vegetarians also not eating the diet properly. For example, when I see the patients, most non-vegetarians eat non-veg only weekly, twice or thrice. Rest all the meals they're eating again high carb diet only. And also non-veg also, they think that eating biryani, eating non-veg curry with rice, chapatis, again they'll indulge carbs along with their proteins. It is eating high carb diet and processed foods is the major cause of diabetes epidemic in India.
Absolutely.
Right. So, is it right to say that because of lack of protein, we are eating more carbs?
That is also one of the reason, because, for example, if you are if you know how to optimize fiber and protein in your meal, automatically your intake of carbs will reduce.
Right, right.
For example, I tried this. For my patient, I practically advise these things. I'll tell them that you forget about all this low carb, keto, and all those things. I will tell about the body physiology. Your body need a fiber. Your body need a protein as per your body weight, at least 1 gram per kg body weight. And your body also need a carbs, but not in the refined form, at least unrefined forms. I tell them, you follow this order. First, eat a fiber, at least 50 gram fiber in the form of simple salad or sprouts. Then eat your protein, 25 30 gram protein. as per your body weight. At the last, keep your carbs. That carbs, instead of white rice, replace with red rice, minimize it. Automatically, I have found that once they start a meal with a fiber and protein, their intake of carbs will reduce
Right.
because they are 50% full with the fiber and protein only. And in the dinner, I tell them, if you're in the dinner and all, where you're not working at all, you eat only fiber and protein. No need to eat any carbs at all. If you're serious about reversing the diabetes and reducing the weight, eat your carb only for one meal a day. Other two meals, eat only fiber and protein.
Right. So, one common pattern which we see with people is that Indians are not very fat, not obese. They are skinny fat or tofu as we call them. Uh, but in spite of that, we tend to get diabetes. What is the reason behind that?
See, that could be one thing is Indians, and I do not think agree with you completely. See, I might just give an example. You see your marriage photograph of your parents' age, 30, 40
Mm-hmm.
years.
Mm-hmm.
In the entire photograph, you hardly see one or two people obese.
Mm-hmm.
You see today's marriage photographs, you see 50% people are obese.
Right.
In addition to that, there are thin individuals who are diabetic because they have a lot of visceral fat.
Mm-hmm.
What happens in this gym culture is not there in the India, especially
Mm-hmm.
somebody who are aged 50 plus now. They think that gym is not for us. The weight training is only for young people. 50 plus people in India think that they're only meant for a walking. If they go to gym, they'll have some injuries and all. The concept is not there. Automatically, after 30 years, they start losing a muscle mass. And once you lose a muscle mass, your tummy fat will start increasing.
Mm-hmm.
So both the ways, the even obese becoming diabetic and thin individual with a visceral fat also becoming diabetic, both are true.
Right. So, I think from reading your post on X, we understand that fasting insulin is a very important test. Could you just tell this for the audience?
Yeah, this is for diabetic diagnosis. People do three tests. One is fasting sugar, second is 2 hours after breakfast, PPBS, and HbA1c. But before the HbA1c goes high, the diabetics initiation has started 10 years before. For example, your fasting insulin, or more precisely, the test called as HOMO IR. It is a formula of both fasting glucose and fasting insulin. If these are high, then that is the time where the diabetic process has started. And from there, 10 years onwards, the HbA1c goes high. So if you can measure your fasting insulin, and if it is high, if you address at that particular point of time, then automatically you can prevent the diabetes. So still common understanding, you can say fasting insulin and HOMO IR test are called as pre-diabetes tests. If HbA1c is a diabetes screening test, fasting insulin is a pre-diabetes test. And
Mm-hmm.
also fasting insulin not only tell you about diabetes, it also tell you about your metabolic dysfunction.
Mm-hmm.
So insulin resistance is not only leading to the diabetic, it can lead to overweight, it can link it to many cancers, it can link it to incidence of strokes, it will link it to your cardiac problems and other things. So you can say fasting insulin is a pre-diabetic test as well as an early predictor of a metabolic dysfunction.
So, what are some of the other tests a normal person should look for metabolic health? Not diabetes specifically, general
Okay.
metabolic health.
The basic thing is first, the basic parameters is a triglycerides. In the lipid profile, many people focus only on the LDL. That's not true. You focus on triglyceride. If your triglyceride is above 100, you might be having a metabolic dysfunction. Your fasting blood sugar above 100 is again maybe indicative of insulin resistance. And your HDL, good cholesterol, if it is less than 50, it can indicate a metabolic dysfunction. And these are the three basic tests. And fourth is your blood pressure. Your BP is above 130/80, and your waist circumference for Indians, if it is more than 90 centimeters for a man and more than 80 for a woman. These are the five basic metabolic biomarkers everyone should look into. Still then, if you want to look still precisely advanced one, you can add HOMO IR test into this.
So